Hello, ladies and gentlemen, but mostly ladies, and welcome to What's Wrong with Mom?
And baby!
Today we'll present to you 3 scenarios, and you have to guess what's wrong with Mom. Now this is interactive, so audience members, you get to play a part. If you think you know what's wrong with Mom, please use your noisemakers and chime in. You can win a prize. After your guess, we'll check in with our contestants and see how well you did. Now, let's meet our contestants.
Hi, I'm Ina Smarty Pants, and I have a PhD in midwifery from Harvard University.
Hi, I am Anita Reed Moore. I like cheese.
I need to push.
There have been a few variable decelerations on the fetal heart monitor during her contractions. I wonder if something's interrupting oxygen supply to the baby.
Oh, here comes another one.
Okay, push. Here comes his head. And it's out. Now I see what's going on.
All right. The cord blood gas results are in. Now identify the condition and the possible reason for it. Right. Let's see if you were correct. And now let's see what our contestants thought of that and how they would handle it.
This is obviously a case of metabolic alkalosis because the pH is low. I think that's right. These pH numbers are so confusing. Anyways, this is probably caused by the baby throwing up in the birth canal. I see this happen all the time with pregnant women, so it probably happens with babies too. So what I would do is just make sure to give that baby some gravel as soon as it was born.
Actually, that's incorrect. I'm sorry. Ina, can you weigh in on this?
Well, I'm glad I took some notes because there's lots to say about this one. The blood gas results seem to suggest that this is a respiratory acidosis in the baby only. And based on the scenario, I'm going to guess that there was a tight nuchal cord causing oxygen deprivation, decelerations, and the respiratory acidosis. The research isn't quite clear about how best to handle a nuchal cord, whether to cut and clamp it or attempt to pull it over the head or to maintain a hands-off approach. But if birth is imminent and the nuchal cord doesn't seem to be impeding the birth, I would allow things to progress on their own. As far as what to do after the birth, the baby's blood pH was acidic, but it's greater than 7. So if the baby's 5-minute APGAR was greater than 5, I wouldn't expect adverse outcomes. It would not suggest any NICU care. Research has demonstrated that unless the pH is less than 7 and the base excess is less than -12, with a 5-minute APGAR of less than 5, the infant isn't likely to experience any complications. However, if those conditions do exist, the baby's at a higher risk of seizures and complications and should be admitted to the NICU.
Correct. Well done. Now let's take a look at a scenario where the mom's pH isn't all that pH-y keen.
Hi, Anna.
Hi.
Well, of course you look lovely as always, but I do think you're looking a little bit more worn down than normal. What's going on?
Yeah, I'm feeling way more worn down. Everything feels off, actually. I can't keep any food down. I have no appetite. Yesterday, I spent the whole day over a toilet.
Oh, that's been unusual for you lately. You haven't had much nausea since the first trimester, right?
No, I mean, things were pretty rocky in the first trimester, but it settled down and I was feeling pretty good. But now everything feels off. My heart is racing and I just feel awful.
Okay. Well, let's take your pulse here and see how it's doing compared to what you normally are. Yeah, that does seem to be a little bit faster than normal. And I also notice you're breathing a little bit faster than normal. I think because of your symptoms and those things, it's worth investigating a bit more. So I'm going to send you for some blood tests.
Okay.
All right. Let's take a look at the results of those tests. Contestants, can you tell what's going on?
This one's easy. The lady is too acidic from drinking too much lemonade, and now that she threw it all up, she's going to be fine.
I'm sorry, that is not correct. Ina, can you weigh in?
Well, based on the enormous base excess, this looks like a metabolic acidosis. Given the woman's presentation with tachycardia and tachypnea, and the ketones in her urine, and that she came in after short duration but intense vomiting, I'm thinking this could be a case of starvation ketoacidosis. I noticed that the woman's blood glucose is within the normal range. While the ketoacidosis is rare in non-diabetic women, it does happen. It's caused by the accumulation of organic acids derived from the breakdown of alternative energy sources when glucose is unavailable. While in healthy, non-pregnant people, it takes at least 2 weeks for starvation ketoacidosis to occur. But pregnant women experience insulin resistance due to placental hormones, which makes them more vulnerable to ketosis and thus ketoacidosis. The condition emerges during the 3rd trimester, often following a short period of vomiting. Ketoacidosis can be fatal for the fetus, and starvation ketoacidosis often results in cesarean delivery, often preterm, so this would likely be a transfer of care with continued support. Oh, I shouldn't forget to mention, the condition emerges during the 3rd trimester, and women present with symptoms of tachycardia and tachypnea. Fries, McKillop, Joash, and Williamson suggest, however, early identification and treatment with 10% dextrose may resolve the acidosis without incurring the risks of preterm cesarean section. By far the best solution would be to prevent the condition from developing in the first place by quickly addressing the vomiting, ensuring appropriate nutrient intake, and active monitoring of pH and ketone levels.
And you've done it again. That is correct.
Oh, thank God that's over. What is it?
You had a beautiful baby girl. There's quite a lot of meconium in the fluid and on the baby. I've seen that before, but she's not looking as pink as I'd like her to look. I think I'll draw some cord blood gas samples and just see what's going on, make sure everything's okay.
Right, the results are back from the lab, lickety split. Now, let's see if you can identify the condition and the possible reason for it. Let's see how you guys did. Contestants, what do you think is going on and what approach would you take?
Well, clearly the presence of poop in the fluid means that the mom was pushing really hard, and because of all that pressure, she had a bowel movement. It happens all the time. This causes everyone in the room to hold their breath to avoid the smell. Of course, the baby's going to hold her breath too. Babies are very sensitive to smells after all. This is going to cause a drop in the PO2 and a buildup of PCO2, thus lowering the blood pH of everyone in the room.
Again, that is totally incorrect. Ina, what do you think happened?
The blood gas results seem to suggest that this is a respiratory acidosis in the baby only. The presence of meconium-stained amniotic fluid is noteworthy. Studies show that this is pretty common and may occur in up to 30% of births. About 10% of these cases, the baby will experience meconium aspiration syndrome, or MAS, which is a mechanical respiratory problem caused by the meconium, which has been breathed into the baby's respiratory system and that interferes with gas exchange in the lungs. Most babies who experience mild to moderate MAS will display a drop in cord blood pH. Most of these babies recover nicely with a little help, and they often benefit from suctioning of the upper respiratory tract, extra oxygen, and in some more severe cases, a breathing machine to keep their lungs inflated. Health professionals should be on the lookout for signs of infection as the risk increases with MAS babies, and some choose to administer antibiotics as a preventative measure.
It's correct. Great work, Smarty Pants. All right. Ina, you are the winner. And here is Vanna to present you with your prize.
Oh, thank you.
Join us next week on What's Wrong with Mom?
And baby.
This is Mac McCheese signing off.